So good morning again. This is Tyler Huff with Chicago House. Thank you to everyone who has joined us for today's conversation. We just covering a few quick ground rules. If you have any questions, we encourage you to use the chat box on your right to enter those in. I'll be checking those and working with Tracy, our moderator, to answer those throughout the session. And then the last part of today's conversation, about the last 10 minutes or so, will be dedicated to audience Q&A. If you're having any tech issues, please also type that into the chat box or email development@chicagohouse.org. With that, I will turn it over to Tracy.
Hi, everybody. Thanks for joining us today. My name is Tracy Baim. I'm publisher of Chicago Reader, but behind me today, I have some 1980s Windy City Times covers on some of our early AIDS coverage. I went old school and taped them behind me. So I'm really excited to do this today. Excuse any errors or any problems in the moderation are all my fault. I'm really honored to have Lieutenant Governor Juliana Stratton, my former state representative, Comptroller Susana Mendoza, my partner in soccer crime, Michael Herman, the CEO of Chicago House, and LaSaia, the amazing executive director and founder of Brave Space Alliance. So thanks for being here today. I thought we'd start with a general question about how you personally have been coping with the last few weeks, and then we'll go into kind of the work side of it. So if we'll start with the Lieutenant Governor.
Well, thank you, Tracy, and thank you for moderating this important conversation. And we are so grateful for Chicago House for hosting this conversation. So I've been doing well. Needless to say, it is very busy for the state of Illinois. And, you know, most of my days are spent connecting with stakeholders, lots of conference calls and meetings, still lifting up issues relating to equity, and of course, first and foremost, supporting the efforts of Governor Pritzker as he leads our state through this very difficult time. So my team is working remotely, but we are busy every single day, and I'm so proud of the governor's leadership as we navigate these sort of uncharted waters. So I'm really grateful to be a part of this conversation. And to really continue broadening the question of how we think about marginalized communities in the face of COVID-19. But me and my family, we are well. I will say that I know a number of people who have either tested positive and several who have had family members who have died. And so it is also a very sobering time, but we know that we will continue to push through and do everything we can to get past this.
Comptroller.
Well, good morning. It's nice to see everyone. I feel like, you know, this whole concept of social distancing is so critically important, but at the same time, it's even more important to remember that social distancing certainly doesn't mean emotional, more like physical distancing. And so I'm glad that even if it's across a video screen, I get to see some of my friends and people that frankly make me happy, and that includes you guys. So on the personal note, my thankfully so far has remained healthy. We have many people in our prayers every night. When my son and I usually put him to bed, and we have a little prayer time, and lots of people in our prayers today, every day. But my brother Joaquin, who's a Chicago police officer, and he's still out there, and of course of significant worry to me, because he, like so many other people, has underlying health conditions, and you know, we worry about folks like that. I live with an 84-year-old mother who is amazing, and she's my biggest source of worry because she's a diabetic and she's got high blood pressure, and you know, so many of the things that our seniors deal with. And the thought of her catching this from someone is certainly horrifying to me, as it is her catching it from me. So I've done my best to try to stay home and work around the clock from the house. Thankfully, we are pretty tech savvy in this household. And my staff, who's going through similar stressors, they've been doing everything within their means as well to stay healthy. And we've taken precautions to make sure that really just those core critical employees that are physically manning the machines and entering the payroll and accounting data have to be in the office. But essentially, we're still trying to make sure that they're working in as a safe environment as possible. You may have heard in terms of where we're at with our responsibilities with COVID-19. The Comptroller's office has been intimately involved in working hard to secure PPE for all of our frontline providers. Our priorities right now is in coming up with the cash that we need to respond immediately to the incredible leadership that Governor Pritzker has shown and his commitment to securing PPE across the globe. And these are the masks and the goggles and the gloves and the ventilators that our frontline providers have had to rely on in trying to fight COVID-19. So our office has had to essentially, we're in a situation where we're throwing, we've been forced to essentially throw procurement rules out the door. We do not have a federally centralized way of securing PPE. As you know, the president unfortunately did not invoke to its full power the Federal Production Act, and therefore states have been left to try to fight against themselves, unfortunately, to secure limited resources, limited PPE across the globe. And that has driven up the prices dramatically, which is a concern to us, but nonetheless, when you have to get the masks, you have to do what you have to do to get them.
Yeah, we have heard a little bit. We'll talk a little bit more about the work response too in a second. Michael, you want to talk about maybe how you personally are handling it in relation to the crisis?
Yeah, I'm what you call a huge extrovert, so it has been a huge challenge on me because even seeing people over the screen is great, but not the same as seeing them in person. So I've adjusted, but I think the other thing important for me is as you listen to the guidance, wearing a mask has less to do with me as it has to do with everyone around me. Going the one-way aisles in the supermarket if you're there. I just really have, bought into that for the protection of my family. I think the side thing for me is I am a type 1 diabetic, and most of the time I don't think about that very much, but this has heightened my sensitivity to come to my own health and making sure I pay attention to that. So I think that's been a big part, and I'll say I'm drinking probably a little bit more wine and eating a little bit more cheese as I do Zoom meetings with friends. But besides that, it's been a lot of adjustment.
Yeah, I don't drink. I've had one beer in my life, and I've like, I don't know why, I've never even thought about drinking, but lately I'm like, wow, all my friends are drinking. Maybe this is helping them, but I've held up so far. LaSaia, let's talk about how you personally have been working on this. I know you've got also big news coming as well.
So hello everyone, good morning. I'm LaSaia, Executive Director of Brave Space. I think I'm handling pretty well. I've been on lockdown more earlier than most people have because of my partner. So my partner is pregnant, and we are 5 months. So we're trying to figure out how do we continue to do what we need to be doing, but also keep ourselves protected at the same time. So I went on lockdown in end of February. So we started switching things over quickly, and especially pushing things on the internet and Zoom and so forth and so on. But we've been handling it very well. I've been on Hangout, the app Hangout a lot, talking to my families and friends. We stay up late, drinking wine and having conversations, laughing and giggling. And we have movie nights on Zoom. So we pick a movie, and then we have everyone comes on Zoom and we have that particular type of movie night. So I've been handling it very well. I'm a huge extrovert as well, so it's different to actually just stay home. It's been multiple times that I want to run down the street and just scream, "Let me out, let me out." But I've been handling it very well.
And we've got 5 extroverts on this call right now. We're all just jumping. So let's talk about, the topic today is intersection of COVID-19, HIV epidemic, and the LGBTQ marginalization. There are lessons from that era, especially Michael and I are a little bit older, so we're the same age, born and raised in Chicago. We'll talk about that later. But in terms of the practical, what's happening with COVID-19, it calls into high relief the disparities in our country on health and education and criminal justice. All these things intersect with health. So in your role in your professional life, talk about how the various marginalizations and intersections of the work you do, how you see solutions and practical ways that in the case of our 2 statewide reps, what's happening at the state level to deal with that. So if we want to go first with Lieutenant Governor.
Sure. Well, I will say first and foremost, we know that we have, just like in any other situation, we see that there are disparities for vulnerable communities, and that's across the board. So we know that not only do we see issues relating to the health disparities that exist as it relates to COVID-19 and individuals that may have underlying conditions such as HIV or AIDS, but also the disparities that we see around issues relating to access to healthcare, housing, what's happening with those who are essential workers, who we know that there's a disproportionate number who are Black and brown or people of color who are going out every single day on the front lines, who have always been essential, as I always say, but now in the midst of the pandemic, people are saying, oh, okay, we really need the delivery drivers, we need the bus drivers, we need the people who are helping to clean the offices or who are stocking the grocery shelves. So I think that what this has done is this pandemic has not created necessarily new disparities. I say that it has highlighted disparities that have always existed, and now we are seeing that come to the forefront. And I think as it relates specifically, I lead the Justice, Equity, and Opportunity Initiative, which is really focused on how do we think about justice beyond just policing jails and prisons, but think about justice more comprehensively and what does it mean? And I think that what we see right now is really an issue of justice and equity and opportunity. It's a matter of justice, equity, and opportunity as we think about access to testing, for example, and wanting to make sure that those communities that are often don't have access to healthcare, that they can have access to the testing that's going to help us to slow the spread of COVID-19. It's an issue of justice and making sure that we think about the distrust that often exists in communities of color as it relates to healthcare systems, where people have not always been believed when there are symptoms, and when people say, hey, the pain is really great, and say, oh no, just stay at home, you don't have to worry about that. And then of course we think about the mental health toll and the trauma that is happening in communities all across the state and the country, really, as we think about what does it mean to because of the disparities, to see greater numbers of people contracting the virus and also dying in particular communities, while at the same time not necessarily having real access to trauma-informed services. So from a state level, as you know, Governor Pritzker has been very focused on making sure that we expand testing capacity and making sure that people have access to testing to COVID-19 and making sure that it gets to communities that need it the most. And then I think when we overlay that with the issues of HIV in Illinois, we know that that is one of the underlying conditions that can make someone not more susceptible to COVID-19, but certainly having complications and more severe cases of COVID-19. And so we know that there are, in 2017, 40,000 people living with HIV in Illinois. That Illinois ranks 7th among states in terms of reporting new HIV diagnoses by number, and that again is in 2017. And we also know that amongst those that are diagnosed with HIV, that we see the same disparities where Black people contract both AIDS at a rate of that's 8.15%, which is the highest in the state, as well as the highest mortality rate. And same for the rates of HIV, which for Black and Latinx communities, we see the highest rates of contraction. So, and mortality. So I think that, what this means is that we have to bring an equity lens to the conversation around COVID-19, and our response to COVID-19 has to be driven by the data and an equity lens. And it's not just the response right now, but it's the recovery process. Because as we see the unemployment claims going up, as we see people who are essential workers who are still putting their lives at risk every single day, and then when we see the data around who's contracting, I think that we have to have this conversation about the intersectionality around who is most vulnerable, who are the most marginalized communities, and how do we make sure that as we think about our response and the recovery, that those communities are considered at the forefront, because they, in fact, our communities will be the hardest hit.
Yeah, now Comptroller, not everybody is familiar with the role of the Comptroller in the state of Illinois. The word doesn't always translate to average people. Talk about the role your office has in relation to these health disparities and also the resources that get put out throughout the state.
Sure, well, thank you. And Juliana, that was awesome, by the way. I pretty much covered everything. Well, you know, the Comptroller's office is one of those offices that maybe a lot of people don't normally think about, because essentially it's supposed to be the state's chief fiscal officer, the state's accountant. But you might recall that just a few short years ago, the Comptroller's office took on more of an outsized role when Bruce Rauner was our governor. And that's because, you know, we were in the middle of the worst fiscal crisis in the history of the state of Illinois. We had a 2-year budget impasse. That means no budget for 2 years. It made the Comptroller have to be making life and death decisions on a daily basis as to who was going to get paid and who wasn't going to get paid. And the courts had really become the manager in many aspects, or a co-partner with the Comptroller's office in determining payments when there were very limited resources to send out. And we had driven up, you might recall, a $17 billion bill backlog because there was no budget in place. And once that was resolved, thank God, and we were finally getting out of that, my office by statute or by constitution is required to manage the state's fiscal accounts. That's what the Comptroller does, to manage all of the financials for the state and to pay the state's bills. So essentially we're the ones who pay the state's bills. Organizations like Howard Brown, hospitals, education, police and fire, pretty much anything that the state of Illinois funds, those payments are determined and sent out the door by our office. So it's critical that my office be run with a moral compass. And this is what I said back a few years ago when I was running, that we needed to restore the moral compass in the Comptroller's office. And certainly we have definitely restored the moral compass in the governor's office, thanks to Illinois voters selecting a governor who's been an incredible leader during the most important time to be one, which is now. But our office, because I had kind of started to touch on this earlier, we normally think about funding in the traditional sense, right? Like contracts are procured, you sign this contract. Once you bill the state agency, for example, if you are getting, you're doing work on HIV funding, Howard Brown is a perfect example. You know, they provide the services, they invoice the state approves the invoices, those invoices get sent over to me in the form of a voucher, and then we issue payments to organizations like Howard Brown. Well, right now, because the majority of the prioritization of funding is happening around being prepared to fight COVID-19, our office has had to take a more creative approach to finding the money. We normally would have months to plan for a specific output of dollars, but obviously we literally get a lead on 1 million masks that might need a 24 to 48 hour turnaround time. That means finding the vendor, signing a contract, and then procuring the dollars to be able to pay for it up front, which is something we never do. That's kind of what we're doing all the time right now in the middle of this COVID pandemic. So it's really become somewhat of a wild, wild west situation. I've talked about it. You may have seen stories in the press where 2 of my employees on 2 separate occasions each got in their car with a check for over $3 million and drove over 100 miles to meet a vendor that needed the money essentially now. Otherwise, we were going to lose millions of PPE, critical PPE, N95 masks for our doctors and nurses to other states as a result of all of this competition happening in this somewhat of a black market environment. So this is kind of our new normal in the Comptroller's office right now, is making sure that we're able to be as responsive as possible to the COVID-19 healthcare crisis, while at the same time acknowledging that this crisis has just blown a gigantic hole in our budget because people are not working as much. There's a huge degree of unemployment right now relative to where we were 6 months ago. That means a lot less tax dollars are coming in the door, which makes my job of having to manage the already existing $8 billion bill backlog that much more monumentally difficult when we're adding potentially an additional $7 billion of financial loss on top of that. So it was a tough job before. It's certainly gotten a lot tougher, but if there's any silver lining for me to share with you as taxpayers of the prior budget impasse that I was responsible for successfully managing us through, is that we've been there and we've done it and we will do it again. We're going to get out of this. It's just going to be, it's not going to happen overnight. And I've been battle tested and I'm very experienced in managing that fiscal crisis. So, you know, we're ready and we're prepared, but that's essentially where we're at today. And it becomes a balancing act in trying to make sure that we still meet the moral compass requirements of our office to fund programs in organizations like Howard Brown and other organizations that do so much work specific to HIV, but also to other kinds of human services needs. And to Juliana's point, you know, one of the most heartbreaking things that I've seen as controller is when I visited places, especially safety net hospitals, where, you know, for example, at Rush Hospital, they've highlighted that the life expectancy of someone who lives on the Gold Coast is 85 years, but you know, just a few miles further, it's 30 years less, and that's in the African American community. This death gap is very real, and when you talk about concentrated poverty and the legacy of discrimination and inequity, this is what happens. You have a 30-year less life expectancy, the worst in the country, and that's happening right here in Chicago. I've toured the safety net hospitals on the south and the west sides, and it's been just disheartening, and you get struck by the fact that not just the lower life expectancies, but the fact that there are higher cancer rates, for example, in Austin, not just among the people who live in those neighborhoods, but actually the people who actually work in those hospitals. The staff members have a 60 to 70% cancer rate. It's unconscionable, but if one good thing can come out of this horrible experience is that when we are on the other side of this, that we no longer turn a blind eye to the really horrific inequalities that exist in our city and in large parts of our state as well.
Thank you so much for that. Michael and LaSaia, Michael first, we'll talk about LGBTQ community and its impact with COVID-19. We've heard a lot about that from Juliana and Susana, but as LGBT providers, talk about that, how you see that impact. And I know, LaSaia, you can talk about those health disparities because within the trans women of color community, it's even larger. So let's talk first with Michael on that.
I think one of the things that's so difficult for us right now, the first was helping the people we work with, our tenants in our facilities, our clients, to really buy into the need to protect themselves against COVID-19. So helping people to kind of adapt to those social distancing factors, all of those things have been vitally important. But I think another element for us is the fact that people living with HIV are already vulnerable. So how do we help protect them? But as we focus on COVID-19, we also are realizing that a lot of our efforts around HIV have been affected. Testing efforts, being out in the community, our drop-in work, all of the things that are strategically connected to the Getting to Zero plan in Illinois, which is an effort to really end the epidemic status of HIV, which has been around for 35 years now. So how do we continue to do that is a challenge. It's really forcing us to go into a more creative approach, keeping our staffs protected, keeping our clients protected, but how do we get to people who we haven't even gotten to yet, who don't know their status, who really need the services and the kind of things that are offered by an organization like Chicago House. So that has been a huge challenge. Our testers would usually be out in the street at night. They would be going into social gatherings. They would be doing all kinds of work in the fight against HIV, which have now been pulled back. And we're trying to find new ways to be able to do that so that in the next 6 months to a year, we don't fall way behind on the efforts that have been made on HIV. So that's kind of a vitally important piece for us to continue moving forward, to continue those efforts that we put in place to make sure those aren't lost in the midst of COVID-19 while respecting the need to do everything we can around the virus as well. We continue to try to house people. We have open units. We're trying to get people into those units. Housing for us is one of the #1 factors related to health. If people aren't housed, how do you shelter at home? If people aren't housed, how are we going to get them medically adherent to their HIV meds? That is a factor that we'll continue to work for and move forward.
Great, thank you, Michael. LaSaia?
So in this particular pandemic, we have to realize we started a program that was going to have a huge outreach. So we started a program this year called VAMP, HIV/AIDS Manifesting Prevention, because we automatically know what we need, but how do we actually fix them problems when we already know what we need? So we started 3 mutual aid groups around food disparities, housing, and also safer sex. Right. So we have to really go into a point of like, now that we switched into this pandemic mode, we automatically know the numbers are going to go up right now. We automatically know that the concept of like, we have to do what we have to do to survive. Now, how do we help you to survive this pandemic safer? So it actually jumped our mutual aid groups up a little bit higher than what we thought it was going to be. So we previously estimated 15 people. Now we're looking in probably 45 to 50 people in each group are actually trying to reach out to figure out what it looks like to have safer sex. What does it look like to get food in this particular time? What does it look like to stay in my house, but also organize in a way that I don't have the money to pay for my housing. Now, what am I going to do when I have no income? So we have these mutual aid groups actually having these conversations around organizing, around what does it look like to have condoms in your space, and actually passing them out to people that are having sex as well. As we started a food pantry that have reached over 300 people a week. And in the first 2 weeks, we reached 2,000 people. And we don't even know how many people are in them households that we are serving, right? So we did this in a manner of like a pandemic. And we didn't know how big this problem actually was until we noticed the outpour reach of like, we didn't plan to have food for 2 to 3 weeks in our house. We only eat when we need to eat. Now we have to worry about surviving this pandemic and have no food. So we do, we actually deliver weekly. Now we're switching to bi-weekly so we can actually give people more food to switch over every 2 weeks. So it's the continual conversation around, and especially breaking down right now, how the system has maneuvered into, it used to be individualism. Now we have to talk about what does it look like when we have to maneuver away from individualism, and everything that I do affects my neighbor, and everything my neighbor does affects me. So yeah, we have, it's a switch game right now. So, but we've noticed that especially our elders are excited to figure out what Zoom and technology can actually really do.
Yeah.
So,
LaSaia, can you real quick tell who the core audience of clients that Brave Space Alliance serves?
So, Brave Space Alliance center the voices of trans people, trans, gender non-conforming, non-binary. We have a full staff of trans individuals, and especially when we say staff full of trans individuals, these are staff that are in leadership. We've noticed that within Chicago and also Illinois, trans people are not actually in leadership and actually controlling the narrative of trans people. We're the only organization that actually pushed that particular type of narrative forward and allowing trans people to speak their truths in the space and actually being held as leaders to actually do the work that we need to do to disparities and equity in our communities.
Yeah, and I certainly see that COVID-19 will have that multiplier effect on trans women of color who already experience high rates of unemployment and violence and murder. And this is an example that just will make it worse. So I know that Brave Space Alliance and Chicago House both could use a lot of support from folks that are on the calls. Tyler, I think we have one question from the audience we'll go to, and then we'll come back to questions.
Yeah, absolutely. So the one question that I'll start with is how, directed to, I guess, Michael or LaSaia, how do I support someone who has been forced into a queer-phobic home due to COVID-19?
Wow.
LaSaia, you want to go first?
Oh, I can go first. I think it depends on the narrative of the person, right? What do they feel comfortable doing? I can only speak to my narrative in this particular realm of I had to go home because I didn't have nowhere else to go, and I had to particularly face a particular type of violence that no one else faced. Now, is this okay for me to protect myself in this space? Yes. If you do what you have to do to protect yourself in any space that you're in, but also understand in this particular climate, you're not by yourself. And we have to realize that they're not by themselves. If you need to reach out, we're here for you to be reached out to. We still have the resources that we have, and we can also connect you to people that you need to be connected to even talk to, but also be in that space safely, or even maneuver to a new space that we can actually connect you to during this particular climate. So I think it's an understanding that we need to not only protect each other, but also figure out different resources to understand that you're not alone. I think that's the biggest thing that most people are feeling right now, that they're alone in this pandemic, when you're really not alone, when we're actually here asking for you to reach out to us so we can help you. So don't feel like you're alone. That's the best way.
Michael?
Yeah, I definitely think that linkage is essentially important, but housing safety is top on the list, and it's important that people have that shelter. And then there is ways for us to connect people. I think reaching out, finding that link, whether it's through a friend, whether it's through an organization, linking will eventually get you to the services and support that someone needs. So I would just say reach out. Reach out to the person you know now. That person can help you to reach out further. But sheltering and being protected is of the utmost right now, but not to do that in isolation, to make sure there's a way to link outside of that.
Lieutenant Governor?
Yeah, Tracy, I just wanted to add, and I really appreciate it, both what LaSaia and Michael just said about this. Number one, the idea of feeling alone, and then secondly, the idea of a stay-at-home order when there's so many people who may not feel safe to stay at home. And so I just wanted to say, as a resource, just as one of hopefully many resources people can access, the state of Illinois has established something called Call for Calm. If you text the word TALK, T-A-L-K, or for Spanish, the word hablar, H-A-B-L-A-R, you will be, someone will reach out to you. If you text that to 552020, so text TALK or hablar to 552020, and you will be connected free of charge and confidentially to a mental health professional. And again, I know that doesn't always get to some of the unique challenges that different communities may feel, but to start with just a place of, if you need someone to talk to, there is a free resource in the state of Illinois that is available to everyone if needed. And I just wanted to share that.
Yeah, and in terms of the LGBTQ community, luckily a lot of the youth shelters and organizations are much more LGBTQ inclusive these days. Of course, there's Broadway Youth Center at Howard Brown Health, there's La Casa Norte, there's the Night Ministry, El Rescate, Teen Living Programs, which has a new name I can never remember. But there are definitely a lot of resources out there. Center on Halsted has a youth group, but they don't have a physical housing. So each of them provide different kinds of things. Let's take one more audience question, and then we'll go back to the scheduled questions.
Yeah, let's see, this one is, how do we plan to promote testing for youth or at-risk individuals that would usually get tested before engaging in risky behaviors?
Michael, you want to take that one?
Yeah, so we are definitely continuing to find ways to do testing for individuals, obviously respecting all of the social distancing norms. So reaching out, I would encourage people to reach out to me, and I will make sure they get connected with my email, M as in Michael, Herman, my last name, at chicagohouse.org. And we could connect you with someone from our prevention team. They are using teletesting. They are doing a lot of different things. and we can make testing happen. If someone needs to be tested, we could absolutely make sure that still happens for them.
And as mentioned before, Howard Brown Health is still operating as well, and they're also partnering on some COVID testing as well. If you're interested in getting LGBTQ sensitive COVID-19 testing, contact Howard Brown. They've been doing some work, and I think they just announced a partnership in Little Village as well. So that's terrific. Let's talk about some creative solutions in response to health disparities. There's so many, I mean, not only in arts funding and LGBTQ resources and things like that, but let's talk about what the state is doing creatively, because really it's a double hit, multiple hit really, but especially economically as well as on the health front. What are some of the creative solutions you're working on or you've heard about? Let's start with the Lieutenant Governor. You're muted.
I was trying to do so well with my mute button. So I was just saying that, you know, I think overall the big push right now, so we know that everybody under the governor's stay-at-home order, we are, the primary goal is to try to, as we hear this term, flatten the curve. We want to get to this place where we can slow the spread, but also make sure, which I want people to understand, that this flattening the curve isn't just about making sure that we stop the spread, although that's very important. And it's not just about when do we kind of reopen the economy, although, you know, I'm sure everyone is eager to get to that point when it's appropriate. We're not quite there yet. But I think it's really in the context of how do we make sure that there's the capacity in our healthcare system and that we don't overburden our healthcare system. And so we've been really thinking a lot about how do we make sure that we can expand testing and make it more available and more accessible to different communities, and specifically thinking about how to make it more accessible to some of our marginalized communities. And so we've tested, I think by now, around 170,000 people. We know that we have right now approximately or just over 36,000 cases of testing positive for COVID-19 in our state. But remember, we have 13 million residents. And so we're always, that 170,000 tests does not quite get us where we need to go. And we know we've had a lot of challenges from the federal government in terms of trying to make this as accessible as we can. So we want to make sure that if someone needs a hospital bed, if somebody needs a ventilator, if someone needs to be in an ICU bed, that those resources are available. And so we're thinking about how to expand testing. So one of the things that we've done over the last week is expand adding some additional, I think we've added 2 more drive-through state-run testing facilities in the state so that people can have access to testing, but also added that if you have any COVID-like symptoms, COVID-19-like symptoms, that you can get a test even without a doctor's order. And the reason why that's important is because we know, and again, going back to what we know about the distrust that communities, marginalized communities might have of the healthcare system, because of implicit bias that sometimes makes healthcare, the healthcare system kind of say, well, you don't need to do this or you don't need to do that, don't worry about it, you'll be fine. And yet we know that people aren't fine. The goal to address that is to make sure that testing is more available. And so, you know, the ability to get a test if you have any kinds of symptoms without a doctor's order and not waiting for somebody to say, yes, you deserve to be tested, is something that's really important. I think that overall that the state has also focused on what's happening with guidelines. So the Illinois Department of Public Health, recognizing that because of COVID-19, that there are many marginalized communities, including those who are living with HIV in communities around our state, who will be, the challenges of COVID-19 will be exacerbated. And so what we've also done is through our Department of Public Health, we've issued guidelines and guiding principles to ensure that the state continues to meet the residents' needs, including people that are living with HIV, by making sure that to reduce some of these disparities in the administration of healthcare, they've said that we want to make sure that you're still making inquiry as to whether or not somebody is living with HIV, and that diagnostic testing should continue to be done. And so those just a couple of the ways that, you know, even in the midst of COVID-19 treatment, that we have to make sure that we are tending to the needs of individuals who might be more vulnerable to severe cases of COVID-19. And I think the goal is to always be proactive. So when you see this kind of data that says that marginalized communities and people who are dealing with a number of comorbidities and other issues, not to mention on top of higher rates of poverty, lack of access to nutritious food, and living in with food insecurity, places where we know there's going to be high unemployment and lack of housing. All of those communities, when you overlay who really needs to make sure they get tested because they'll have more serious outcomes to COVID-19, we're trying to make sure that that's the case. So that's thinking about innovative solutions to make sure that those communities are reached, and again, to bring that equity lens to the way that we're addressing this pandemic.
Terrific. Comptroller?
Well, once again, fabulous, Juliana. You just got, I mean, you hit every point. I would say those are amazing efforts being done by this administration. I'm super proud of it. And our job is, from the controller's perspective, is to make sure that we can come up with the dollars to pay for them. So, you know, obviously right now, given, like I said, that our financial challenges are so much greater than they were recently, even though they were bad before, right? They're just infinitely worse now. Cash management becomes a massive challenge. But we are not going to put the health and welfare of already vulnerable populations more at risk. So my office is absolutely committed and will continue to prioritize these type of investments, because I do believe that investing in our community is critical, and certainly leveling the playing field for people who already begin on a disadvantage to not have to deal with that for the rest of their lives. So my administration will continue to prioritize, and just to be clear, like the amazing work of Chicago House. We have been proud to, the minute we heard that you guys were having challenges, to, you know, say, what can we do to help? And frankly, I've made it clear that these type of DHS funded programs are on our priority list. And we're going to continue to prioritize organizations like Chicago House and others that are on the front lines providing these critical human services to people. And frankly, we're so important when it comes to prioritizing. You guys are so important to us that organizations like yours do get about a 48-hour turnaround from when I get the voucher given to me from the Department of Human Services. We get them out the door right away. We really can't prioritize any faster than that. So in order to be effective at making sure that our HIV populations and other healthcare critical or vulnerable populations get the services that they need, you can have the intent to do that, but we're going to make sure that that intent gets turned into a reality by making sure that the dollars are there to supplement the actual thought that the governor is doing when it comes to leading on this effort. So we're committed, and we look forward to making sure that whether it's public health dollars continue to be prioritized or it's DHS dollars continue to be prioritized, those will not be the dollars that are on the chopping block when we're going through having to navigate this crisis.
That's great. And I think on the state government side, I think some of this also calls attention to the business community and being able to support smaller businesses in the future from the state's perspective, and the city and the county, that a lot of these small businesses are going to need, you know, you buy catering, you do all these other kinds of things. I think we need to be creative in supporting the for-profit and nonprofit smaller businesses, especially those owned and operated in the state versus corporate headquarters elsewhere.
Yeah, can I add one more thing? You know, our biggest challenge right now is you hear that we're getting these federal dollars, right, for CARES, and Juliana, this probably is driving you nuts too. You know, as a person who has to manage this money, so this week we got about $1.3 billion in the CARES money to us, which sounds great, but there are so many strings attached as to how it can be spent that it's like infuriating. So, I mean, if I had $1.3 billion, and I know that we're looking at a $7 billion hole, plus the $8 billion that we're managing right now, knowing that there's all of these critical programs that, you know, they're doing work related to COVID-19. I mean, if just this organization, Chicago House alone, is out there trying to find housing for people because, even more so because of COVID-19, yet those dollars can't necessarily be, or those services can't be leveraged for dollars related to this federal spending. So we really need to make a more concerted push and just keep this issue at the forefront, that we do need additional federal help. It's not a bailout, it's really a realization that the federal government has a responsibility to care for its citizens in every state, and that those dollars should be allocated to states in a way that will actually help the people who are being hurt the most by this pandemic. Yes, Juliana.
Yeah, I just want to say you know, that also, as you correctly pointed out, is something that gets me every time. With the PPP loans, which are supposed to be focused on helping small business owners, we know that there were a number of, to go to your question, Tracy, so many small business owners that were boxed out. And quite honestly, again, we see that same issue of intersectionality, where we see businesses owned by people of color specifically boxed out, and businesses owned by women specifically boxed out, because so many of the banks are focusing on organizations or businesses that already have an existing relationship, existing banking relationship, which we know, due to structural racism, so many communities of color do not have that, business owners do not have that relationship. And then secondly, they're focusing on not just those that have existing relationships, but the larger companies. And so when we think about supporting small businesses, you're absolutely right, Comptroller Mendoza, that we have to make sure that what the federal government is doing is thinking about those who might be most vulnerable of shutting their doors, and how do we make sure that we can help keep these businesses open. And I just wanted to mention that in my office, we've had 2 initiatives, one called We Are Illinois, which is lifting up small business owners, as small businesses, as well as nonprofit organizations that have gone above and beyond the call of duty during COVID-19, and thinking of ways we can support them, as well as one focused on cultivating our communities, which is focused on agricultural businesses, and how do we continue to support those who are supporting our food supply chain, who are also struggling during this time. So I just wanted to piggyback off of what you said, that it's absolutely, you knew me so well, that yes, it bothers me that some of those who are in the most marginalized communities, who need the most help, are not the ones that are getting the help that they need so that they can sustain. And we have to support our small business owners, but when we do so, we have to make sure it's done in an equitable way.
So, I was going to talk about how your response is in the creative space. You've been doing a lot of different responses for your community.
It kind of bothers me just a little bit. So we're talking about so much money, we're talking about small businesses, we're talking about all these particular things, when, like, at the core of our work, my community does not have the abilities to even get a job at these small businesses, because they refuse, because they're not palatable enough, or they don't have the insurance to even get this test that they're trying to get for COVID. I have many of my clients of my community that are afraid, that they know that they had COVID, but knowing that they don't have Medicaid or Medicare to take care of themselves, cannot go to one of these centers to get tested, because they're asking for insurance, right? So it's a complete, like, total, sometimes it's a complete slap in the face, because we're talking about all this millions of dollars of, like, everyone's getting all this money, but there's not even a drop focus towards trans individuals that we can actually ask for, right? I'm literally the only Black and brown trans-led organization in Illinois itself, and, like, trying to receive even the droplets of continually getting denied by the city and the state is, like, a frustrating conversation to even have, because the continuous pushback that we continue to get is that, yes, you're trans, yes, we understand all this particular type of language, but you know what? Let's handle them first, and then when we are able to get back to you, we can get back to you. And it's a continual pushback and continued denial, right? But you continue to have our language, and you continue to talk about us in the particular spaces, but we don't have shareholders or even a droplet of how do we continue to keep our communities alive or even thriving in this moment. And the connections that I've created or connected with BSA and partnership with COH has opened them particular doors to allow us to start up the food pantry, to allow us to do the Trans Relief Fund, that we have over 700 people on how we're going to raise $70,000 to at least give them each something, right, in this particular pandemic, when they're asking for $500, $600, $2,000 per person. And some of these people are not able to get a stimulus check. Some of these people are like literally living day to day to figure out how can I eat, or where can I lay my head at. So it's a continuous, like, where is that door going? When is that door going to open? And how are we going to get that door open in this particular pandemic? And the continuous pushback of how the city and the state has failed us in ways that they need to correct these particular ways. So yeah.
I wonder if our state elected officials, just quickly, Michael, could address organizations that really operate in the most margins, where they don't fit the qualification and check the boxes of the larger groups.
So I think the PPP is a perfect example. Chicago House did our application. We were in on April 10th, and we did not get funded in the first round. Now, our fingers are crossed for the second round, but I hear what LaSaia is saying. We have some infrastructure to produce those applications, and we have not found a way for the resources to make it to organizations without layering on levels of complication. And that has to be solved. Otherwise, we're going to have trouble always funding those organizations. Chicago House has been around for a long time, and we still struggle in that arena. And I think it's the inequity that is systemic in these funding sources. So the PPP was a perfect example. You can't blame a bank for supporting their biggest clients because those are their biggest clients. What's the motivation to them to work with smaller community-based organizations to make that happen and to make those resources available to them? So that's it's a challenge.
Where does the state put its money, and what banks, right? We need a reorganization of power. Where do small businesses bank? We need to bank at the banks that didn't do that, that treated everybody the same. And where does our city, state, and money go? Because there's billions of dollars they're hosting in these banks. And if those banks weren't fair, then their money, our state tax dollars need to go to the banks that were. But I'd love to have an answer for the state officials in terms of LaSaia's question is, like, how do these organizations, right now you're in emergency mode, you're funding things non-traditionally. Can an organization like Brave Space Alliance get emergency funding to their clients?
So we are,
yes.
I'm sorry. Do you want to go, Juliana, or do you want me to go? You should go because you're.
No, go ahead.
Okay. So
no, go ahead.
Okay. When it comes to emergency funding, what I meant by that, just to be clear, is procurement has changed in the sense of a normal procurement process with a vendor. And we're talking specifically about procurement for PPE, which is the personal protective equipment, the masks, the goggles, that kind of stuff. Those procurements for goods and those types of goods would normally take 3 to 6 months. And it would be like IEMA, that's emergency management, right? They would enter into, they put out a bid, and there would be multiple bidders, and they would take 3 to 6 months to go through that process. And then once they finally chose their vendor, they would sign a contract. They would get the goods in hand, inspect them all, make sure that the order was legit, and then they would approve payment. Right now, this is all happening in like 24 to 48 to 72 hours. And we're working with vendors that we've never worked with before. Because of the emergency order or the disaster proclamation, the normal procurement process is just not existent when it comes to procuring PPE. But everything else is still, your contracts are your contracts and so forth. This issue that I think, LaSaia, number one, let me just say, and I don't mean to sound patronizing in any way, like, you are inspirational. And you know that I believe this because we awarded you before as just an incredibly amazing person who we honored during our LGBTQ History Month. And I'm always continually inspired by you. And I will tell you that the fact that you are so committed to just, working on behalf of other people and like putting your passion into the benefit of others, right, is something that I never want you to lose, no matter how challenging it might seem. Please don't give up. And let me know if there's any way that I can help, and I will do my best to do so. So I think it's unconscionable that you don't have either city or state or any type of funding, frankly, to like pursue helping other people. So I will do what I can. I'm sure Juliana will do the same. I mean, like, we want to help you help others. And I know that you are as as legitimate and committed as they come. So I think this might just be a scenario of connecting you with people who are the right folks to talk to when it comes to, you know, making sure that you have a 501c3 that's registered and that you can apply for funding, and then have advocates that can say you deserve to have this money. Now, again, the work of Chicago House and other folks like that is so important, and it is infuriating. I know so many people that have small businesses that have applied for these loans and have been denied. Yet you suck, Shake Shack, return the money because they're like, yeah, okay, we got busted, we probably shouldn't have gotten it. And other, like Harvard University is returning their money. And all of these like massively well-established, cash-rich corporations got this PPP funding instead of your small businesses that this was intended for. I will commit to speaking to Treasurer Frericks, who in the past has taken very strong leadership when it comes to how we invest our dollars and has had very serious conversations with those banks that we do business with, and say, why on God's earth is it okay to give a company that frankly doesn't really need the money, yet the folks here in Illinois that are providing these jobs, who have those essential workers who right now, if you're not one of those, are on the verge of perhaps having to close your business down, the folks that we need to help the most during this pandemic. So I think it was a really good point about that you made, Stacey, as to, you know, are we having these conversations with the banks? And you better believe we will.
Okay, great. And Juliana, you had.
Yeah, I just wanted to say that if insurance, not having insurance should not be a barrier to accessing testing. We have a number of sites all around the state. And if you are finding that some of the individuals that you're working with are not able to access testing, then please, let's stay in contact. I will make sure that you have the ability to reach me or my team so that we can be assistance, because you're absolutely right. It should not be a barrier. And I think, you know, I come from the space of being a restorative justice advocate, and I believe, as we say in the restorative justice world, that wisdom is in the room. And one of the issues is that when we don't have trans or gender nonconforming people in positions of leadership in, you know, as we continue to do our work in government, to hear what some of the concerns are on the ground, then that can be something that is an issue. So we continue to want to make sure that I appreciate your raising the challenges. In fact, I started a campaign you may be familiar with called Hear Our Voices, because I said we keep talking about trans women of color. We talk about gender nonconforming individuals who, but we don't include their voices directly. And so when you tell me this is what you're hearing and this is what you're experiencing, I need to listen, and I need to make sure that we do whatever we can to make sure that the accessibility is there. So I look forward to working with you even after this call to make sure that we can follow up, and I'll make sure someone from my team gets in touch with you so that we can talk about barriers that you are seeing and get solutions to those barriers.
Thank you.
Yeah, we're nearing the end of the hour, and we have other questions, and there's just so much we could talk about on the historical front. I hope we can maybe do this again. I don't want to, you know, go too in depth, but, you know, I started my work in 1984 when HIV/AIDS had fewer than 100 diagnosed cases in Chicago. And Michael, I know you came out during that time too. There are comparables to that era, but there are so many different things. Hundreds of millions of people have died of HIV/AIDS in this country in the last 39 years. And many of them disproportionately representative of marginalized communities. We know that disproportionate impact on people of color, African American and Latinx especially. So there are lessons we can learn. I've linked to some articles, including Mark King's terrific piece about how it isn't the same or it is the same, the debate that's going on. There are comparisons we can learn, but I think the most important one is the activism and the fighting back. And whenever you learn something that didn't work, pivoting to another way. And I think we know that capitalism isn't working right now. Our own federal government is working against you in the state. There are things that we can take from all of that and be more supportive of the authentic Illinois and Chicago people that are doing this work, rather than waste our resources on people that are multinational companies that are not reinvesting in communities, landlords that are absentee, that are not helping their communities. So I hope at the state level you are able to take that and pivot and use the heavy clout you have to make those changes more substantive over time, whether that's in criminal justice reform, which is your baby, Juliana, and Susana on a more equitable Comptroller's office. LaSaia, we all as an LGBT community need to help you more do the work that you're doing. And Chicago House, I've covered since your very first meeting. I think it was at the Baton Show Lounge in the mid-1980s. The work that you do is still amazing. Housing first, criminal justice reform, health disparities, and public, I want a public bank. I want a public credit card and a public bank. I'm sick and tired of all these banks making all the money off of our taxpayer dollars. And we certainly need universal health care. So those things all intersect with our LGBT community. And I'd love to continue this dialogue some more. I know that Chicago House has another session coming up soon. And Tyler, do you want to talk about that for folks?
Yeah, absolutely. So we are working on a second part to this and bringing, bringing individuals from some of the other queer serving organizations throughout our state together to continue the conversation that was in a lot of the great points that were mentioned today. So we'll, it's looking like it's the first or second week of May. So stay tuned on that one.
And hopefully some of the questions that didn't get answered today can be brought up in that session. And I put my email at the very top of this if anybody has any one-on-one questions you want. And Tyler and the folks at Chicago House can put you in touch with the folks on the panel today. I really appreciate it. It was really tremendous, great input, but we need to take those things that we talked about and action them, including helping our LGBTQ organizations. Thank you all for joining us today.
Thank you. Please stay safe.
Thank you, Tracy.
Thank you.